There's another virus spreading in India that's looking a little COVID-y. Looking a little COVID-y. This one's called the Nipah virus. There's reportedly an outbreak of this in West Bengal. And I say, outbreak because some reports say there have been at least 5 confirmed cases among healthcare workers linked to a private hospital in West Bengal. Other reports say there's only been 2 and are saying like, hey, don't go spreading around, these narratives and numbers that aren't real. So, I'm sure we'll get a clear number count in the coming days. But one of the people who is infected with this is said to be in critical condition. No cases reported outside of India so far. The problem with all this is that there's a high death rate. So the death rate for the Nipah virus is like 40 to 75%. Dang. You can kind of see, this is the CDC kind of screenshot that we have here for you. It says 40 to 70%. Regardless, it's a pretty high death rate. And there's no vaccine or medicine to treat this. Can also reportedly stay dormant for over a month. And so this is why the World Health Organization has Nipah among its top 10 priority diseases because of how it could become an epidemic if it spreads. But it's just also a situation where you could have no symptoms.
Dang.
You know what I mean?
So first China, now India. And it's a bat again?
A bat again?
I know these bats probably like, y'all can't even give me my bird. Why y'all keep coming at us? And it's a fruit bat. So what I was reading is fruit bats, right? That's what I was reading. It's the fruit bats, and they eat the fruit, and then after they eat the fruit, the people. That's what I was reading in the notes.
There's a couple different ways where this could, and if you have like bats that are infected with this, and it's like the bat virus gets into the fruit, and you eat the fruit, and it's got the saliva on it, there's a couple of different ways. To your point, though, at some point, do we just kill all the bats?
Yeah, get rid of the bats.
What are we talking about here?
Or switch the ammo up. Switch the lie up. You know what I mean? I'm not saying it's a lie, but switch the lie up. Go to another animal. It can't be the bats all the time. Can't be the bats all the time.
You're questioning.
You dig what I'm saying? I'm always questioning. So it can't be the bats all the time. And also, man, if you see... Let's go for my Indian people. If you see a fruit that has been somewhat eaten by anything... Don't eat it.
Maybe don't eat it.
Don't eat. Just use your logical mind. Don't eat it. If I see anything that looks halfway eaten or just somebody nibbled in it, I'm not taking a bite. I'm just not going to take a bite. I don't care what it is. I'm just not taking a bite.
Alto Key says bat lives matter.
Bat lives matter.
That's crazy.
Listen, not
crazy.
When
they
it's
spread
like
disease.
listen,
they spread diseases.
People are going down because of these bats. We might need to,
bro.
have an offense at this point.
Yeah.
Yes. So this can spread in various ways. Either eating fruit that was partially eaten or contaminated by bat saliva or urine. Drinking raw date palm sap contaminated by bat secretions, or direct contact with bat droppings or bodily fluids. Now, they did do what you suggested and change up the animal because this can also spread because of pigs. So if you handle sick or infected pigs, or you have exposure to pig respiratory droplets in farms or in slaughterhouses kind of situation, contact with pig blood or urine or other bodily fluids, you can get this. Human-to-human contact happens as well with this spread, and that's coming into contact, close physical contact with an infected person, either by getting exposure to their respiratory droplets, coughing, sneezing kind of situation, or potentially kissing bodily fluids like saliva, blood, urine, vomit, anything.
I'm worried now.
At
first, because at first it was bats. I was like, cool. I was like, I don't mess with bats. I've never seen a bat before. But pork now? Pork? I'm cooked.
Oh,
I'm cooked.
We got to save you. We have to save you. We got to get you off this pork, brother. I'm about to talk to you like a Muslim. We got to get you off this pork, brother. That swine is not fine, my brother.
You don't eat pork? You eat bacon.
I do. I do.
But yes, so there are different countries that are surrounding this area, like Thailand and Taiwan, who've kind of taken some steps to mitigate this from spreading into their countries. In fact, in Taiwan, pretty sure they stopped people from coming into the airport without getting tested. Oh my gosh, I'll have to find where that is. But they're basically doing things right now to mitigate how fast and how far this spreads. And again, if we are talking about something that is a very serious disease, but, is at 2 to 5 people right now.
Yeah.
Y'all better be on it. Like we saw what happened with COVID. You better be on it at this point. It was Thailand that began screening passengers at a couple of airports that get flights from West Bengal. So they're on it. I mean, they're saying, we're trying to cap this thing before it gets weird, but that's what they said last time.
Yeah, I know. What is this? It's called the Nipah virus?
Nipah virus.
The Nipah virus.
I don't know how to. Why do you say it like this?
It's too close to HIPAA.
Oh, that's
HIPAA?
not what I thought you were thinking.
I was
Oh,
thinking something differently
See,
too.
y'all are tripping. Y'all are tripping. I'm thinking about HIPAA. Y'all thinking about, we know what y'all thinking about. Y'all crazy.
I don't know how alarmed to be about this because, again, if we're talking about 2 to 5 people and you have contained it already, I will say that there's like 110 people they have quarantined.
Okay.
And the incubation period is between 4 and 14 days. So, hopefully there's not more here. And that's why they kind of put out this alert to say, hey, we have our eye on this kind of thing. But I guess I'll be worried about when it's time to worry about it. You know what I mean? Sometimes people tell you stuff and it's like, oh, time to be afraid. It's too early.
But
too early.
sometimes when we get told it's too late. Because I remember back in 2019, right before 2020, in December, I started seeing the little COVID things pop up, like ads and like things in the news. But I was like, it ain't gonna touch America. This is back when it was in China.
Yeah.
Once it reached America, it was too late. I was in 2020, it was too late. Everything had already went downhill. So I don't know. Maybe we should take this serious.
We probably should, man, because I can't do another shutdown.
I can.
You know what?
You said you can?
Man, the shutdown was peaceful as ever. I had the most peace, the most relaxing time during the shutdown. It was so quiet where I stayed at.
Oh, really?
Yeah. Everybody was walking around the neighborhoods. Folks was walking their dogs. I felt really connected to the community.
But shut up.
How? For what?
We don't need no more shutdowns. No more shutdowns, bro.
I just remember even if you needed to clear your throat and you were out in public, the whole community would descend and stare at you. You just, I'm sorry, I'm not sick. You had to explain anything. You sneeze and you got 16 people around you ready to throw you out the store. Boy, COVID was weird.
Where were y'all at during COVID? Because during COVID, it was so peaceful for me. Georgia, it seemed like we was one of the only states that didn't really take it super, super serious.
Oh, Florida didn't take it seriously
At all.
So that's what
Florida
I'm saying.
didn't have a pandemic.
We was chilling out down south.
No, I was in a blue state. I was in North Carolina, and North Carolina took it very seriously. We were shut down forever.
Really?
Long after Georgia reopened,
Yeah.
North Carolina was still shut down. They were not playing games in North Carolina. And it's funny because when we were there, it just seemed like we were the normal ones, and all the red states that had opened up were just like, oh my God, I can't believe you guys opened up. I can't believe you guys would be killing your people like this. And now, you kind of hear what you know now about COVID and just different investigations that have been had into some of the claims of COVID and the 6-foot rule and just different things that have come to light since. And you're like, man, who had it right? Who had it more right? The red states that opened up, or the blue states that tried to mitigate the spread and stayed shut down?
No, that's real.
I don't know. I'm not a scientist, but
Yeah.
yeah.
No more shutdowns.
I don't know if they could pull off a shutdown like COVID, though. Because so many people had so many questions and suspicions around COVID. I don't know if they could play it like they did last time.
Also, it was so much scamming going on during that COVID. So I don't think the government could either they could do it again and they could be like, hey, we're gonna do it this way again, or it's just like, yo, we not shutting down no more because y'all were giving y'all too much money. We gave y'all way too much money for free. Way too much money. So
Yeah.